The primary benefit of OptimiseRx for me is patient safety. The tool underpins all the safety procedures and guidance which will result in very, very cost-effective prescribing. This is seamlessly embedded on our clinical system, so basically one GP wouldn't notice that if all the prescribing was absolutely spot on in terms of evidence-based approach. However, we all know that there is some variations. When those variations occurred, the tool will flash back certain pieces of evidence to make you think, to prompt you to sort of correct or adapt your prescribing to whatever the local formulary is or whichever document applies to that area of disease, taking the particular elements of the patient's case and the situation into account. It's actually quite brilliant in the way it works, because it doesn't slow your mental process that much, but actually it provides you with the reflection, with the information to apply relevant knowledge immediately at the point of care. Type 2 diabetes. Cases where we're dealing with diabetic nephropathy, patients may develop a reaction to ACE inhibitors. If you got a prescription, just let's say Ramibro, and you haven't deactivated that prescription and trying to prescribe losartan, the computer will reflect and it will say you are doing a dual blockade and that's not really advised. Just consider reviewing that prescribing, which it will be perfectly safe. It will avoid significant cases of renal impairment and other coexisting comorbidities. OptimiseRx is able to collect data in terms of the prescribing habits of every individual doctor or health professional for that sort. I think that data could be fed back to the prescribing advisors for further analysis. There has been a lot of talk about variations within particular clinical commission groups, and for years we've been trying to tackle these variations with a set of data which could have been felt probably not that fair on certain practitioners. I think with this different type of collection of data, we can really identify not just patterns of prescribing, but actually patterns of behavior towards prescribing. Because I don't believe that there is an isolated area of poor prescribing. Sometimes that could be seen within a wider kind of agenda for specific practitioners, which will require support and addressing by the CCG. I'm not talking about punishing people, I'm talking about aiding people to understand what the pitfalls could be so they can be supported. The previous prescribing aiding tools were quite primitive and they were focusing purely on producing savings. Some people could have found that very patronizing or interfering. I think OptimiseRx provides relevant information, relevant guidance, extremely useful and absolutely essential from the safety point of view for any GP currently. I think it will help medical directors, clinical governance procedures, and it will help every personal professional, a personal term in terms of the professional development and appraisal. I think the tool is much more than just prescribing. It's an ongoing learning tool.